Hello, everyone. Welcome to Therapy Clips with Dr. O. Today, our topic will focus on common challenges in stopping drug use. There are 4 categories of challenges, and these categories are anger, irritability. Number 2, boredom, loneliness. Number 3, special occasions, parties, dinners, holidays, celebrations. And the final category is encountering using friends at the clinic or program. Okay, so let's get deeper into these challenges so that you can understand fully exactly what it consists of, and then we'll talk about the approach that you should take to deal with the challenge. So the first category, once again, is anger, irritability. Now, there will be times when things make you angry, and there will be times when you just are so irritable. And it seems that things are occupying your time, your thoughts, and your space. Well, guess what? There are ways to deal with these situations. So small events can create feelings of anger that seem to occupy your thoughts and can lead to relapse. Remember, relapse is full blown. It means that there's a continuous cycle of using without intervention. A slip is that one-time occurrence that you slip up and you use a drug of your choice, but you get right back on track to do the things that you need to do to keep yourself clean and sober. So when you are angry and irritable, here are some approaches that you can take. Just remind yourself, especially in early recovery, that you are experiencing a healing of the brain. And strong, unpredictable emotions are a natural part of recovery. You can do things like exercising or distract yourself with any activity that you enjoy to get your mind away from drug use. You can talk to a therapist, or you can focus on talking to someone at a meeting that you will go out to attend, or some other supportive friend. Now we're in category 2, boredom and loneliness. When you stop drug use, this means that the activities that you once did, you are no longer doing, because those activities more than likely pertain to using some type of drug of choice or drinking alcohol. You want to stay away from these things, okay? So, put new activities on your schedule is one of the solutions. Go back to activities that you enjoyed before you started using alcohol and drugs obsessively. Try to find new friends at your community support meetings. In other words, at your NA meetings, your AA meetings, and any other type of meetings that you may attend. Okay, so now we're in category 3. And when you think about category 3, think about those special occasions that occur, like parties, dinners, holidays, and other types of celebrations. You need to know in advance how to handle these situations that you will encounter. Because remember, you have changed, but some of the people around you may not have changed and will like to continue to engage in activities that they enjoy. So what do you do when you're in situations? Have a plan for answering questions about drug and alcohol use, or not using at all. Start your own drug-free celebrations and traditions. You don't have to wait for someone to have a party. You can have a party of your own. without having drugs and alcohol available and focusing on non-drug using, alcohol drinking friends. Have your own transportation when you attend these events, because if you want to leave because it's becoming uncomfortable for you, then you can up and you can leave because you have your own transportation. Also, anytime that you're feeling uncomfortable and feeling deprived in any situation, don't stay with that situation. Leave that situation and go where you're going to be more comfortable, and know that you will remain on the road of recovery if you do. And our final category is when you encounter friends at a program or at the clinic. Now, you may decide that I'm going to attend the program or I'm going to go to the clinic when I know there's not a lot of people there. And that way you will not encounter these friends who may be still using and trying to recover, because recovery happens at different stages for different people. So always keep in mind that you may attend a 12-step meeting, but somebody may walk through the door and they may be high or they may be still using, and you know that you're at a different level because you are not high and you are not using these days. Develop effective ways of avoiding conversations at the clinic or at the program. Do not discuss anything with anyone that you do not want to have a conversation with about what's going on with you personally, other than to say, if they ask you to engage in drug activity with them, drug using activity that is, then this is what you say. You say, I'm no longer doing that. And please respect the fact that I'm no longer doing that. And I'm going to need to go in a different direction because I want to remain clean and sober. And the final thing to do when you encounter these people is just tell them, I don't want to discuss drug use. It's not a topic of concern unless we're in a group session. And that's just simple. Okay? All right. So on your worksheet, and I have sent these worksheets out to you, you have 2 questions to answer as an activity. Which of these issues are you likely to be a problem for you in the next few weeks? And then the second question is, how will you handle them? So once again, which of these issues are likely to be a problem for you in the next few weeks? And how will you handle these issues? Have a blessed day, everybody. As always, be safe. And remember, you are strong enough to face each challenge of each day when your spirituality is intact and you submit to your higher being. That is the God of your understanding. All you have to do is pray and meditate and ask him for the strength to get through the situation and to get through the day. Be blessed, everyone.